Hey, it's Nurse Key here, and welcome back to the new Nurse Boot Camp. Alright, so I want to play a game. Can we play a medication game? Let's go over our medications. So, in nursing school, we generally learn pharmacology, right? So, we know our medications. However, when you actually become a nurse, there are certain medications that you will consistently give. So, almost separate from your NCLEX medications, there's another group of medications that you actually have to learn. So I'm going to hold up the medication name and you're going to guess what the indication is for each medication, okay? All right, let's get started. Lorazepam or Ativan. Do you know what this one is given for? Ativan is given for anxiety, agitation, and even active seizures. Clindamycin. Remember the mycin suffix? That's the antibiotic. Cefamapine. This will be a consistent one. This is a cephalosporin antibiotic. Amoxicillin. Now that second word, clavulant. I don't always say that one. I generally pick the easiest medication name to say, and that's what we go with. So augmentin. Augmentin is an antibiotic. It's a class of a penicillin. Metronidazole or Flagyl. Flagyl is an antibiotic generally given for UTIs and other infections. Azithromycin. Here's another ending in mycin. It's an antibiotic. Rocephin, another antibiotic, and it can be used for major infections like pneumonia, meningitis, gonorrhea, or UTIs. Zosyn. This is a major one that usually you give piggyback. Again, it's an antibiotic that could treat pneumonia, intra-abdominal infections, sepsis, and skin infections. Vanc. This is a common one. Um, and this is another antibiotic used for things like MRSA or C. diff. Since we brought up C. diff and Vanc generally cannot be given oral. It doesn't work in the oral route of Vanc. You have to give it IV for it to actually treat the C. diff. C. diff is a infection of your stool. Fentanyl, I'm sure you're aware of this one. This is one of your pain medications, generally given IV, but also it can come in oral medication. Morphine. Morphine is another pain medication that can be given generally IV medication. Toradol or Ketorolac, another pain medication. Hydromorphone or Dilaudid, another pain medication given IV. Oxycodone, this is a common pain medication. Tylenol, of course, this could be acetaminophen, 325, 650, 750, 1000, just different milligrams dosage. Xanaflex or tenanzidine, and this is one. Um, this is a muscle relaxer. So when you give a muscle relaxer, of course, you have to make sure the patient or let the patient know that they could be drowsy, no driving generally with that medication, no interactions with alcohol, because it could counteract. Aricept or Donzepine, Donzepil, Donzepil. Okay, skip that one. Aricept, this is actually a dementia or Alzheimer's drug, and it helps with brain or cognitive function. Mannitol. Mannitol is another diuretic generally given for cerebral pressure. So it would be actually, mostly it's like neuro ICU. You don't just give mannitol. It's actually a critical care medication oftentimes because you'll have to have ICP monitoring most likely with that medicine. Um, Gabapentin or Neurontin, that's a medication given for neuropathy. Baclofen is also for muscle spasms. So you're going to educate your patient on muscle lethargy, weakness, drowsiness, and watch them driving in interaction with alcohol. Phenytonin or Dilantin. This is an anti-seizure, anti-convulsant medicine. Dilantin is a special medicine because you actually monitor the blood levels for this drug to make sure that the levels of the drugs is not too high or too low within this within the patient to make sure you're preventing seizure activity. So the serum drug levels are to be 10 to 20 micrograms per milliliter. And let's end with a good one. Levodopa and carbidopa is Cinnamon. This is a anti-Parkinson's medications to kind of Parkinson's. Sometimes they have rigid tremors, and this is to soften the tremors and to slow or smooth out their muscle or motor function. So let's play a game, medication rapid fire. I say the name of the medication, you tell me the indication. Heparin. Now heparin, I like to remember this one as heparin hospital. Generally, heparin is given in the hospital, and the other one we'll talk about is Coumadin, which is usually given on discharge. Heparin is a blood thinner to prevent that person from clotting, to have a slower clotting time. We of course check blood levels to make sure that their clotting time is accurate and make sure this medication is therapeutic. Heparin will check the APTT or the 10A or XA, depending on which hospital that you may be at. It's generally given for DVT, PE, or after MI. Heparin can be given IV, generally an IV infusion, or IV or sub-Q injection, just depending on the order. All right, so warfarin, like I said, warfarin or Coumadin is another blood thinner that's generally given outside the hospital after they have had an initial start of anti-coagulation therapy. Warfarin and Coumadin is another one that you will have to check their lab values for, which will be INR, and it's 2 to 3 to say that it's at a therapeutic level for this medication. So of course, given an anticoagulant medication, you're going to check that patient for excess bleeding, whether it's in the gums, nasal bleeding, rectal bleeding. So you'll say no contact sports, no hard toothbrushes, no electric, actually no manual razors. You'll have to use the electric razors. This one, apixaban or Eliquis. Eliquis is a oral medication that is also anticoagulant, and it actually inhibits the factor 10A. So it's given for the same indications. It's an oral medication that generally is like long-term therapy. Xarelto is another one with the blood thinner, and it inhibits the direct factor 10A, which is one of your clotting factors. Again, you'll watch for bleeding, bruising, and GI upset in these patients. Another one is Pradaxa. Pradaxa is like a little bit newer to the market versus some of the other ones like Eliquis and Xarelto, but it has like the same symptoms that you'll watch for, and it's to inhibit or prevent clot formations in patients that have already had blood clots, whether that's the DVT, which will be in your extremities, or a pulmonary embolus, which will be in your lungs. All right, we're moving on to another category, ferrous sulfate, which is an iron. Iron, of course, can be given orally. It can give a liquid solution, which generally you're supposed to drink through a straw so it doesn't stain your teeth, and you give with orange juice. We learned that in nursing school. But the iron IV infusion, which they generally don't talk about, comes in a black solution in the IV bag. It's a clear bag, but it's like black, greenish tint to it, and you'll run that per the order. You educate the patient on constipation or dark tarry stools. Erythropoietin or Epigen. This is a medication to actually stimulate the production of red blood cells. and this is given, of course, in anemic patients. This is given sometimes before dialysis if it is ordered. So, of course, you would check your lab values to see what is their hemoglobin levels, hemoglobin red blood cell levels, and generally, sometimes they will have to get a blood transfusion, or we can go through this medication. Excuse me. All right, so levothyroxine or Synthroid. Now, this is a big one. This is given for hypothyroidism. And of course, that would be proven by a lab. But this medication is important to understand that it's supposed to be given on a blank or empty stomach, not blank, an empty stomach. So that's generally given before breakfast time. Most facilities, they may order this at 4 or 5, which is difficult because now you have to wake your resident up out of their sleep for generally 1 pill. But it is supposed to be given on an empty stomach. Lovenox. Lovenox is another anticoagulant. It's actually a form of heparin, and this is generally only given in hospitals or acute care settings. Lovenox, you can remember Lovenox and Love Handles because it's given in the sub-Q region of the body. So Lovenox, it usually already comes in a pre-drawn syringe. Take it out of the container and just administer it to your patient. Of course, you'll still watch for bleeding, bruising, and GI upset in these patients. All right, Solumedrol. Solumedrol, and usually you actually see this long methylprednisone, and you're like, what is that? I usually just remember Solone and the cortisol family. This is an anti-inflammatory medication, and it's a corticosteroid, generally given IV push, but it can have other routes. Albuterol. Albuterol is something that you could give across the board. This is something that we do. Okay, so albuterol, this is something that we learned in nursing school about the bronchodilator. Remember to do the bronchodilator versus a corticosteroid. So albuterol is a, like I said, a bronchodilator. It will open up your airways, and then you would give a steroid to keep it open, to harden it. This is like a rescue medication at times too for people with asthma or COPD. Plavix. Plavix is another one in the family for antiplatelet agent, and you would look for bleeding, bruising, GI upset, or actually low platelets. Aspirin. Of course, aspirin is kind of a generic medication, but in nursing there's different milligrams of aspirin. So if you work in a facility, especially like something like a SNF facility where you have to pull individual medications, is be careful of the actual order. Is it aspirin 81, which is more for the heart? Is it 325, or I think it's even 625 for aspirin? So just be careful of the doses because they actually do different things. Carvedilol or Coreg. This is a beta blocker. Coreg is generally given to decrease the heart rate or blood pressure. A beta blocker will, it like dilates, so it's beta blocker 1, beta blocker 2. 1 is in the heart, and I always think beta blocker 2 is in the lungs. So beta blocker 1, it actually dilates the blood vessels, drops your blood pressure, and drops your heart rate. So of course you want to check your vitals before you're giving Coreg. Generally, most facilities will have an order. If it's less than 60, you're going to hold Coreg because it's going to drop it even more. But always check your orders for your parameters. All right. Rosuvastatin. That's a hard one. All right, and Crestor. Crestor is a cholesterol medicine. I always think of statins and the cholesterol. Cholesterol is pretty easy to understand. Think about your blood vessels and think about fat lining them. That's the statin, that's the plaque buildup, and after, well, that's the fat, then it hardens and it turns to plaque. These medications, they'll try to reduce the buildup of the plaque and the fat inside of your arteries, so they don't occlude. All right. Atorvastatin, which is also Lipitor. Lipitor is another cholesterol medication. Sometimes Lipitor is more common in the hospitals, and sometimes it's just prescriber's preference. Lipitor is cholesterol medicine to prevent the plaque and buildup in your arteries, and that will prevent heart disease. All right, Zofran. Zofran is, of course, given for nausea, vomiting, and it's generally given in a tablet or oral medication, but it can be given by IV, just depending on the facility and the order that is given.